Talkopolis, the social media TV network for your city.
Hi guys, Kane Harrison here. Welcome back to Nashville Health and Wellness Program. We are again joined by Dr. Hamilton of Icon Pediatrics, who is the founder of this fantastic organisation. Welcome, Doctor.
Thank you.
Now, we went into some depth about the differences between perhaps adult concierge programs and the pediatric programs that we have last time. There's some very unique things that you can offer people who come and join your program. Let's talk about that.
Sure. Well, there's several things that we do that I think will separate us from other pediatric practices because we have the time to spend with patients that we didn't have in the traditional practice model. One example is we have been certified to provide a service called CogMed. It's a tool, an online tool that we use for children who've been diagnosed with attention deficit disorder with or without hyperactivity. And it's been proven to show that we can help enhance the treatment, the current treatment of ADD, which is primarily relying solely on medications, by improving the child's working memory. What that means is the child will have an intensive 5-week course where they'll interact with an online activity that we train them how to use at home. And if they do this for 30 minutes a day for 5 weeks, it's been shown that we can enhance and improve the child's working memory. And that means his ability to recall information and retain that information.
I just think it's incredible, and I know I said this off camera before, but I definitely want to reiterate the fact that I think what I love about it is that this demonstrates your ability to develop relationships with your clients and that you care enough to want to see the outcomes. Someone coming in for a 5-week program, and we all know the major shift has been over the course of time, perhaps because of the way that we interact with doctors, is that I'll just write a prescription and everything will be fine.
That's right. I mean, we've created that in our society, and it's unfortunate because there's so much more that we should be doing when we care for patients than just writing a prescription. But sometimes that's what the consumer wants, and it's also sometimes what the doctor wants because it's just quick and easy. But I think to really do a better job, we have to go more in depth, spend more time. And you know, we find, like for example, with our adolescent population, most children get 1 visit a year if they're healthy and doing well. They'll come in and get a physical for school because they need it for sports, for example. But we may not see them for another 12 months. And so in the concierge model, we guarantee that we are going to have a greater number of touches with each child. And so, for example, instead of having 1 wellness visit, we'll have it divided up into 4. So we'll have 1 visit that's scheduled mainly for the musculoskeletal and cardiac exam, another that's scheduled for looking at mental health issues, another that's scheduled for looking at the school performance issues, and another visit that may be just for a visit of the parents choosing. But at least every quarter we want to see that child in the office. And again, there's no additional cost because you're paying that as you go in the monthly membership.
Now, to a lot of people at home, the concierge model for pediatrics may be incredibly new and they're thinking this is fantastic. Now, I think that the payment schedule is brilliant and obviously is new, but quite honestly, you're just going back to the way it was. You're going back to that good old-fashioned service. You're going back to developing relationships with families.
That's right.
And so it gives you a fantastic ability to be able to diagnose problems because you can spend time with them and see their lifestyle.
Sure.
Talk about how you ended up back there.
Well, it was a number of factors, but you know, I had done a lot of things in healthcare. You know, I'd been creative, broken new ground, provided a bunch of new services, and I built a very large practice, became the largest practice in the state, and enjoyed that, and I think we did a lot of good doing that. I sold that business though in 2013, and as a result of that sale, decided I wasn't ready to retire from medicine altogether. I still like the patient contact. I still feel like I can do things that are of value. And the concierge model, it creates a lifestyle where the doctor can see a comfortable number of patients, but not be overwhelmed by that volume. And then you're free to do some other things. So my extra time is spent mainly in areas of community service. So for example, the nonprofit that I started called Better Health for Kids, we've talked about that before. That's a way that I can, you know, serve a population that may not be able to be my patient, but I can see that they're getting enhanced care through Better Health for Kids. So there's a variety of other things I can do that can be of service, and I'm not required to just do it solely based on, you know, how many patients can I see and how much revenue can I generate and that sort of thing. I'm not trying to grow an empire. I've done that before, enjoyed that, and did a lot of good with that. But now I'm focused on how do I make sure that I make a difference in the life of an individual child, not a whole community at one time.
I think it's fantastic what Dr. Hamilton is doing, and I love his practice, as I've said in the previous interviews, I've been into his office, and it's really warm and welcoming. The staff are fantastic, and I would definitely recommend for you guys to check out the concierge service, as it is quite brilliant. Dr. Hamilton injects himself into the community incredibly well, and he's quite modest in talking about his practices outside of work, but they are brilliant. And I just think it's a great way for you and for some of your potential clients, the people watching, to develop a relationship with a doctor that's ongoing. And as you talked about, as your children get older, mental health issues, bullying issues, all those different things, for you to be able to have that proximity to a family, I think in diagnosing certain things is just remarkable, and the concierge method is a brilliant way of doing that. Doctor, we've enjoyed having you on the program so much. Thank you for coming past. And I really would like you guys to go and check out Icon Pediatrics and everything that Dr. Hamilton is doing. And we'll see you next time on Nashville Health and Wellness Program.